Musculoskeletal diagnostic techniques. As we start talking about injury evaluation, we need to understand the different ways that we can utilize technology to assess and diagnose different conditions and injuries. We will talk about some of the most common techniques utilized to diagnose musculoskeletal injuries or conditions. Radiographs, magnetic resonance images or MRIs, computed tomography, bone scans, and diagnostic ultrasounds are collectively referred to as diagnostic imaging. Diagnostic imaging. We need to be careful when you say someone needs an MRI. Remember that only physicians can order these tests. So the tests we're going to explore today include radiography, computed tomography, magnetic resonance imaging, nuclear medicine, ultrasonic imaging, electromyography, and nerve conduction studies. To obtain the clearest image of the involved structure, the diagnostic energy for radiographs or X-rays must strike the body from a specific direction and angle. Energy may pass from the anterior through the posterior tissues in an anterior to posterior model, or posterior to anterior in a posterior anterior model, or from a left to right lateral projection. The patient and the generator may be aligned so that the energy strikes the body at a right angle, or images may be obtained using an oblique or an acute angle. Radiographs are the most common imaging techniques used in the diagnosis of orthopedic injuries. X-rays were discovered in 1895, and it made it possible for the first time to view internal structures without invasive techniques. Prior to discovering X-rays, the only other way to find out what was going on inside of an individual was to open them up surgically. Radiographs are commonly used to identify fractures, and because of their low cost, they are often ordered prior to asking for an MRI or a CT scan to evaluate joint space issues or joint surface quality. X-rays are not sensitive enough to identify some forms of acute fractures, such as those involving the scaphoid or acute stress fractures. Stress radiographs determine the effects of stress on a joint. These require special positioning using either weights or manual stress that is applied by the technician. The assessment of the joint's ligamentous integrity often requires the use of imaging techniques, which stress is applied to a joint to measure the amount of laxity, also known as a stress radiograph. Other forms of radiographic screening involve the use of radio-opaque dyes that are absorbed by the tissues, allowing for the visualization of radiographic examination. This is collectively known as contrast imaging, arthrograms, myelograms, and angiograms, and they have various applications to specific body systems. With the availability of MRI techniques, these types of studies are less frequently used to diagnose orthopedic injuries. The interpretation of radiographic imaging can be based on the ABCS method. A stands for alignment. We observe for the normal continuity of bones and joint surfaces and the alignment of one bone with another. B is for bones. Bones should have normal density patterns, presenting with a uniform color throughout the bone as compared bilaterally. Cortical bone appears brighter. Cancellous bone is darker. Areas of decreased density appear as darkened areas within the bone. Fractures and abnormal bony outgrowths, such as exostosis, can also be visualized. C is for cartilage. Although cartilage itself does not produce a radiographic image, the cartilage and the ligamentous structures are inspected for what does not appear. The joint spaces should be smooth and uniform. S is for soft tissue. Although soft tissue cannot be imaged, swelling within the confines of the soft tissue or between the soft tissue and the bones can be determined. In addition, the outline of the soft tissue and even pockets of edema within the soft tissue can be identified with adjusted exposure techniques. A CT scan, or a computed tomography scan, uses many of the same principles and technology as radiography, but is used to determine and quantify the presence of a specific pathology, rather than as a general screening tool. In the case of CT scans, the X-ray source and the X-ray detectors rotate around the body. The speed and the number of slices acquired depends on the number of detectors. Spiral CT has improved accuracy, requires less radiation exposure, and has a faster acquisition time than traditional CT. The patient will lie still on a movable table that positions the target body part in the circle containing the scanning equipment. For CT angiography, the contrast medium is injected into a blood vessel prior to the scanning procedure. Optimal visualization of certain tissues requires injection or swallowing of a contrast medium prior to the scan. An MRI, or a magnetic resonance imaging, offers superior visualization of body soft tissues. Functional MRIs, or fMRIs, are used to detect metabolic changes to the brain. fMRIs are useful in tracking changes in brain activity following a stroke, traumatic brain injury, or a tumor. Magnetic resonance angiography, or MRA, uses MRIs to study blood vessels, and its relative lack of invasiveness makes it preferable to a catheter study. Contrast material is sometimes injected into the bloodstream to better visualize the vessels. The only known limitations to the administration of this procedure lie with individuals who suffer from claustrophobia, individuals that are fearful of entering an enclosed tube, or those who have some type of implanted metal. An MRI can often be safely used even if the patient has implanted metal, such as a surgical staple, pin, plate, or screw, as long as it has been in place longer than 4 to 6 weeks. The open MRI eliminates or reduces claustrophobia by minimizing the immersion in the imaging tube and reducing the level of magnetism required to produce an image. Sprains or other connective tissue damage involving loss of tissue continuity, fluid accumulation, or nerve entrapment are common pathologies that can be discovered via MRI. These pictures indicate the relative signal intensities of selected structures on spin echo musculoskeletal magnetic resonance imaging. You can see the difference in the exact same image with T1, proton density, and T2 weighted MRI protocols. We can see the fat, fluid, fibrocartilage, ligament, tendon, muscle, bone, and nerve all illustrate differently in either bright, intermediate, or dark imaging with the different contrasts. These different techniques can be used when we're trying to evaluate different types of tissues. Bone scans are a form of nuclear medicine that are used to detect bony abnormalities that are not normally visible on a standard radiograph. The patient receives an injection of a radionuclide, which is a tracer element that is absorbed by areas of bone undergoing excessive remodeling or hotspots. These areas appear as darkened spots on the image and must be correlated with clinical signs and symptoms. Bone scans can identify common pathologies, including degenerative disease, bone tumors, and stress fractures of the long bones and the vertebra. Defects in soft tissue structures, primarily superficial muscle, such as the Achilles tendon, patellar tendon, and the rotator cuff tendons, can be identified using diagnostic ultrasound, also known as a sonogram. Some internal organs, the testes, breast, and a fetus, can also be viewed using a sonogram. Diagnostic ultrasound uses sound waves having a frequency between 1 and 15 megahertz, depending on the depth and the type of tissue being imaged. Gel, or a coupling medium, is applied to the skin over the target area, and then the technician runs the transducer head over the target area, capturing a specific image on a computer. Sonograms are relatively inexpensive, are easy to obtain, and are risk-free to the patient, but the quality of the resulting image is significantly influenced by the skill of the operator. Accessibility and portability of the imaging device is also an advantage. Nerve conduction studies, or NCS, and electromyography, EMG, are diagnostic techniques used to detect pathology in peripheral nerves and the muscles that they innervate. Peripheral nerve entrapment, such as carpal tunnel syndrome and tarsal tunnel syndrome, nerve root injury or muscle disease such as muscular dystrophy and myasthenia gravis have been detected using nerve conduction studies and electromyography. A motor nerve conduction study is used to examine motor peripheral nerve function and to detect pathology along its path. The nerve is stimulated with an electrical current, and activity from the muscle innervated by the nerve is identified and recorded. Two primary measurements are obtained. First, latency, the time it takes for the impulse to travel to the target muscle, and two, amplitude, the magnitude of the nerve's response. An EMG or electromyography study is an invasive procedure that involves inserting a thin needle detecting electrode into the muscle. At rest, the muscle should be electrically inactive and we should not see a signal. The patient is then asked to contract the muscle, and the shape, size, and frequency of motor unit action potentials are measured and assessed. Both of these tests, nerve conduction studies and electromyography, are often done at the same time to assess nerves and the muscles. This table is a helpful reference guide and presents an overview of the techniques used to diagnose musculoskeletal injuries. This is a good table to be able to reference back to during this semester. There are many factors that determine if a specific diagnostic test is going to be used. Cost, accuracy, risk to the patient's tolerance, the skill of the operator, and the availability are all factors in determining which diagnostic technique should be used. Because of its low cost and availability, radiography is frequently the first step to determining if there is a bony pathology. For some suspected pathologies, other imaging techniques are quickly ordered in the presence of a negative radiograph and persistent symptoms.